Question 1. The efficiency study reveals that a significant portion of behavior consulting cases involve clients who interpret their pets' vocalizations and body language through a heavily anthropomorphic lens, leading to interventions that are ineffective or detrimental. In such a scenario, what is the most ethically sound and professionally effective approach for a certified animal behavior consultant to take when addressing the client's interpretation of their pet's communication? Option A. Conduct a thorough, objective assessment of the animal's communication signals within its environmental context, and then use this evidence to educate the client on scientifically validated principles of animal communication, collaboratively developing an intervention plan. Option B. Agree with the client's interpretations to build rapport and ensure compliance, even if those interpretations are not supported by behavioral science, and tailor recommendations accordingly. Option C. Immediately correct the client's anthropomorphic interpretations by presenting scientific literature that refutes their beliefs, emphasizing the objective reality of animal behavior. Option D. Focus exclusively on the client's description of the animal's communication, using their subjective interpretations as the primary basis for developing an intervention strategy. Correct answer is A. Conduct a thorough, objective assessment of the animal's communication signals within its environmental context, and then use this evidence to educate the client on scientifically validated principles of animal communication, collaboratively developing an intervention plan. Explanation. Scenario analysis. This scenario presents a common challenge in behavior consulting where a client's perceived understanding of their pet's communication differs significantly from the observed behavior and scientific understanding. The professional must navigate this discrepancy while upholding ethical standards and ensuring the welfare of the animal. The challenge lies in bridging the gap between subjective interpretation and objective behavioral science, requiring tact, clear communication, and evidence-based recommendations. Correct approach analysis. The correct approach prioritizes a thorough, objective assessment of the animal's communication signals within its environmental context. This aligns with the IOP ethical guidelines, which emphasize evidence-based practices and the welfare of the animal. By focusing on observable behaviors and scientifically validated communication principles, the consultant can provide accurate insights and develop effective, humane intervention strategies. This approach respects the client's perspective while grounding recommendations in professional expertise and ethical obligations. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the client's interpretation and imposing a singular, scientifically derived explanation without acknowledging the client's experience. This can alienate the client, erode trust, and lead to non-compliance with recommendations, ultimately harming the animal's welfare. It fails to meet the ethical standard of client-centered care and effective communication. Another incorrect approach is to validate the client's interpretation without critical assessment, even if it contradicts established behavioral science. This can lead to the implementation of ineffective or even harmful interventions, directly violating the IOP commitment to animal welfare and evidence-based practice. It also fails to provide the client with accurate information necessary for understanding and modifying behavior. A third incorrect approach is to focus solely on the owner's perceived communication signals of the animal, neglecting the broader context of the animal's environment, history, and physiological state. This limited perspective can lead to misinterpretations and ineffective solutions, as animal communication is multifaceted and context-dependent. It bypasses the core competency of a behavior consultant to analyze behavior holistically. Professional reasoning. Professionals should begin by actively listening to the client's observations and concerns, validating their experience without necessarily agreeing with their interpretation. The next step is to conduct a comprehensive behavioral assessment, observing the animal's behavior in its natural environment and gathering relevant history. This objective data then forms the basis for explaining communication principles to the client, using clear, accessible language, and providing evidence to support the analysis. The intervention plan should be collaborative, incorporating the client's capacity and willingness to implement strategies, while always prioritizing the animal's welfare and adhering to ethical guidelines. Question 2. Process analysis reveals that a client is seeking assistance with their dog exhibiting persistent barking at the mail carrier. The consultant is considering how to best understand the underlying reasons for this behavior to develop an effective intervention plan. Which of the following approaches most accurately reflects a functional assessment of behavior in this context? Option A. Advising the client to purchase a specific anti-bark collar advertised to stop barking instantly, without further investigation into the behavior's triggers or purpose. Option B. Relying on the client's description of the dog as aggressive and suggesting they simply ignore the barking, assuming it will eventually stop. Option C. Systematically observing and recording the specific instances of barking, noting what happens immediately before antecedents and immediately after consequences the barking occurs to hypothesize the function of the behavior. Option D. Immediately recommending a muzzle and aversive training techniques to suppress the barking, as it is clearly a nuisance behavior. The correct answer is C. Systematically observing and recording the specific instances of barking, noting what happens immediately before antecedents and immediately after consequences the barking occurs to hypothesize the function of the behavior. Explanation. This scenario is professionally challenging because a functional assessment of behavior requires a systematic and objective approach to understand the antecedents, behaviors, and consequences, ABCs, that maintain a specific behavior. Misinterpreting or oversimplifying these relationships can lead to ineffective or even harmful interventions. The IOP certification emphasizes evidence-based practices and ethical considerations, meaning interventions must be grounded in scientific understanding and prioritize the animal's welfare. The correct approach represents best professional practice because it adheres to the core principles of functional assessment. By systematically observing and recording the context, antecedents, the specific behavior, and the outcome's consequences, the consultant can form a scientifically sound hypothesis about the function of the behavior. This hypothesis then guides the development of an intervention plan that addresses the underlying cause of the behavior, rather than just suppressing the outward manifestation. This aligns with IOP commitment to ethical practice, which mandates interventions that are humane, effective, and based on a thorough understanding of the animal's needs and motivations. An incorrect approach that focuses solely on the immediate observable behavior without considering the underlying function fails to meet IOP ethical standards. This is because it risks applying aversive or punitive measures that do not address the root cause, potentially increasing stress, fear, or aggression, and violating the principle of do no harm. Another incorrect approach that relies on anecdotal evidence or personal opinion rather than systematic observation and data collection is also ethically problematic. IOP expects its certified consultants to utilize scientifically validated methods, and relying on unsubstantiated claims or personal biases can lead to ineffective or detrimental outcomes for the animal and its human caregivers. Furthermore, an approach that prioritizes quick fixes over a comprehensive understanding of the behavior's function neglects the complexity of animal behavior and the ethical obligation to provide thorough and evidence-based guidance. Professionals should approach such situations by first establishing clear, measurable definitions of the target behavior. They should then engage in systematic observation, collecting data on antecedents and consequences across various contexts. This data should be analyzed to develop a testable hypothesis regarding the behavior's function. Intervention strategies should then be designed to modify the antecedents or consequences to reduce the likelihood of the behavior, while also teaching alternative, more appropriate behaviors. Ongoing data collection and analysis are crucial to evaluate the effectiveness of the intervention and make necessary adjustments, ensuring the animal's welfare and the success of the behavior modification plan. Question 3. Cost-benefit analysis shows that while aversive training methods might yield quicker initial compliance in a dog exhibiting resource guarding, a positive reinforcement-based approach, though potentially slower, is more aligned with long-term welfare and ethical practice. Considering the IOP ethical framework, which of the following intervention strategies best balances effectiveness with animal welfare? Option A. Implementing a gradual desensitization and counter-conditioning protocol, rewarding calm behavior around the guarded resource and teaching alternative behaviors. Option B. Restricting access to the guarded resource entirely without providing alternative outlets or teaching new behaviors. Option C. Utilizing a shock collar to interrupt guarding behavior immediately, coupled with verbal reprimands. Option D. Employing a prong collar to create discomfort when the dog approaches the guarded resource, thereby discouraging guarding. The correct answer is A. Implementing a gradual desensitization and counter-conditioning protocol, rewarding calm behavior around the guarded resource and teaching alternative behaviors. Explanation. This scenario presents a professional challenge because it requires an animal behavior consultant to balance the immediate desire for rapid behavioral change with the long-term welfare and ethical considerations of the animal. The consultant must apply principles of operant conditioning in a way that is both effective and humane, adhering to the ethical guidelines of the International Association of Animal Behavior Consultants, IABC. The challenge lies in selecting an intervention that maximizes positive outcomes while minimizing potential negative side effects, such as increased fear, anxiety, or the development of new problem behaviors. The correct approach represents best professional practice because it prioritizes the animal's welfare and employs a scientifically sound, ethically responsible method of behavior modification. By focusing on positive reinforcement and gradual desensitization, the consultant is adhering to IABC ethical code, which emphasizes humane treatment and the avoidance of unnecessary suffering. This approach is also more likely to lead to sustainable behavioral change and a stronger human-animal bond, as it builds on trust and positive associations rather than coercion or punishment. The IABC guidelines, while not a formal legal code in the same way as government regulations, represent the professional standards and ethical commitments expected of its certified members. An incorrect approach that relies heavily on punishment or aversive techniques would represent a significant ethical failure. Such methods can lead to increased fear, anxiety, and aggression in the animal, potentially exacerbating the original problem or creating new ones. This directly violates the IABC commitment to humane treatment and the principle of do no harm. Furthermore, using such techniques without careful consideration of the animal's emotional state and the potential for unintended consequences demonstrates a lack of professional judgment and a failure to uphold the standards of the profession. Another incorrect approach might involve implementing a complex plan without adequate client education or support, leading to inconsistent application and potential harm to the animal due to misinterpretation or improper execution of the techniques. This would also be an ethical failure, as it neglects the consultant's responsibility to ensure the client can safely and effectively implement the behavior modification plan. The professional decision-making process for similar situations should involve a thorough assessment of the animal's current behavior, history, and environment. The consultant must then consider various operant conditioning strategies, evaluating the potential benefits and risks of each in relation to the animal's welfare and the client's capacity. This involves a systematic risk assessment, prioritizing interventions that are least likely to cause distress or harm. The consultant should also consider the scientific literature and evidence-based practices, aligning their recommendations with the ethical guidelines of their professional organization. Finally, clear communication with the client, including education on the chosen methods and ongoing support, is crucial for successful and ethical intervention. Question 4. The assessment process reveals that a client's dog exhibits significant reactivity when approached by unfamiliar individuals in the home environment. To accurately document the nature and triggers of this reactivity, which observational method would best align with the IABC ethical guidelines and commitment to objective, welfare-focused assessment? Option A. Engaging in direct, playful interaction with the dog while simultaneously attempting to document its responses to the presence of a stranger in the room. Option B. Conducting a structured observation session where a confederate, unknown to the dog, enters the home and approaches the dog at a predetermined distance, with the consultant observing from a discrete location. Option C. Utilizing a remote camera system to record the dog's behavior over a 24-hour period without any human presence during the recording. Option D. Asking the client to repeatedly introduce new visitors to the dog throughout the observation period to gauge the dog's reactions. The correct answer is B. Conducting a structured observation session where a confederate, unknown to the dog, enters the home and approaches the dog at a predetermined distance, with the consultant observing from a discrete location. Explanation. This scenario presents a professional challenge because the consultant must balance the need for comprehensive data collection with the ethical imperative to minimize stress and disruption to the animal. The chosen observational method directly impacts the validity and reliability of the data, as well as the welfare of the subject. Careful judgment is required to select a method that is both scientifically sound and ethically responsible, adhering to the IOP Code of Ethics and Professional Practice, which emphasizes humane treatment and evidence-based practices. The correct approach represents best professional practice because it prioritizes non-intrusive observation, aligning with ethical guidelines that advocate for minimizing interference with the animal's natural behavior. This method allows for the collection of ecologically valid data, reflecting the animal's typical behavior in its environment, and upholds the IOP commitment to animal welfare by avoiding methods that could induce fear, anxiety, or distress. This approach is supported by the IOP emphasis on observational techniques that are objective and minimize observer bias. An incorrect approach that involves direct interaction or the use of novel stimuli during observation would be professionally unacceptable. Such methods could elicit reactive behaviors that are not representative of the animal's baseline state, compromising the integrity of the assessment. Ethically, this would violate the IOP principles of minimizing harm and distress. Furthermore, it could lead to misinterpretations of the animal's behavioral repertoire, potentially resulting in inappropriate recommendations. Another incorrect approach, such as relying solely on owner reports without direct observation, would fail to meet the IOP standards for objective, evidence-based assessment, potentially leading to biased or incomplete data. The professional decision-making process for similar situations should involve a thorough understanding of various observational methods, their potential impact on animal welfare, and their scientific validity. Professionals should critically evaluate the specific context, the animal's species and individual temperament, and the goals of the assessment, prioritizing methods that are least likely to cause distress while yielding reliable data is paramount. Consulting relevant IOP guidelines and ethical codes should be an integral part of this process, ensuring that all actions are justifiable and aligned with professional standards. Question 5. Compliance review shows that a client is seeking assistance for their dog's fear-based reactivity towards other dogs. The client expresses significant frustration, stating they have tried various methods that haven't worked quickly enough and are now requesting techniques that will make the dog stop barking and lunging immediately, even if it's a bit harsh. The consultant is considering several approaches to address this behavior. Option A. Promise the client that a specific, rapid training protocol will eliminate the reactivity within a week, and if it doesn't, the consultant will provide a full refund, without a detailed assessment of the dog's specific triggers or learning history. Option B. Implement a behavior modification plan that utilizes positive reinforcement and counter-conditioning, gradually exposing the dog to controlled stimuli at a distance where it remains calm, while simultaneously teaching alternative behaviors and educating the client on the principles of classical and operant conditioning. Option C. Recommend immediate application of aversive tools and techniques, such as choke chains or prong collars, combined with forceful corrections whenever the dog exhibits reactivity, with the goal of suppressing the unwanted behavior through punishment. Option D. Focus solely on managing the dog's environment by preventing all encounters with other dogs and advising the client to simply ignore any signs of reactivity, without addressing the underlying fear or providing alternative coping mechanisms. The correct answer is B. Implement a behavior modification plan that utilizes positive reinforcement and counter-conditioning, gradually exposing the dog to controlled stimuli at a distance where it remains calm, while simultaneously teaching alternative behaviors and educating the client on the principles of classical and operant conditioning. Explanation. This scenario is professionally challenging because it requires the consultant to balance the immediate needs of the client and their animal with the long-term ethical and regulatory obligations of professional practice. The client's frustration and desire for rapid results can create pressure to adopt less evidence-based or potentially harmful training methods. The consultant must navigate this pressure while adhering to the International Association of Animal Behavior Consultants, IOP, Code of Ethics, which emphasizes humane, science-based practices and client education. The correct approach represents best professional practice because it prioritizes the animal's welfare and the client's understanding, aligning with IOP ethical guidelines. By focusing on positive reinforcement and gradual desensitization, the consultant is employing scientifically validated methods that minimize stress and avoid the potential for negative side effects associated with aversive techniques. This approach also empowers the client by educating them on the underlying learning principles, fostering a collaborative and sustainable behavior modification plan. This aligns with the IOP commitment to evidence-based practice and client empowerment. An incorrect approach that relies solely on punishment or aversive techniques fails to meet IOP ethical standards. Such methods can suppress behavior without addressing the underlying emotional state of the animal, potentially leading to increased anxiety, fear, or aggression. This violates the IOP principle of do no harm and is not considered a humane or scientifically sound practice. Another incorrect approach that focuses only on the outward behavior without considering the learning history or environmental factors neglects the complexity of animal behavior and the principles of learning theory. This superficial approach is unlikely to yield lasting results and may lead to the client feeling frustrated or the problem re-emerging. A third incorrect approach that involves making promises of guaranteed rapid results without a clear understanding of the individual animal's learning capacity and the specific behavior's history is unethical. It sets unrealistic expectations and can lead to client dissatisfaction and a breach of trust, as well as potentially encouraging the use of inappropriate methods to achieve those promised results. Professionals should approach such situations by first conducting a thorough assessment of the animal's behavior, history, and environment. They should then educate the client on the relevant learning theories and principles that explain the behavior. Based on this understanding, a humane, evidence-based behavior modification plan should be developed collaboratively with the client, clearly outlining realistic timelines and expectations. Ongoing assessment and adjustment of the plan are crucial, always prioritizing the animal's welfare and the client's ability to implement the strategies effectively. Question 6. System analysis indicates that a certified animal behavior consultant is presented with a client whose dog exhibits sudden aggression towards children. The consultant's initial assessment suggests the aggression may be linked to pain or discomfort. Considering the IOP ethical guidelines and scope of practice, which of the following best defines the consultant's immediate professional responsibility regarding the definition and scope of animal behavior in this situation? Option A. To provide advice on managing the dog's environment to prevent interactions with children, without considering the underlying cause of the aggression or the need for veterinary consultation. Option B. To immediately begin developing a behavior modification plan for aggression, assuming the behavior is purely learned and not medically influenced. Option C. To diagnose the specific medical condition causing the pain or discomfort and recommend a treatment plan, as this falls within the broad definition of addressing the animal's overall well-being. Option D. To recognize that the scope of animal behavior includes observable actions, underlying motivations, learning processes, and environmental influences, and to prioritize ruling out medical causes by referring the client to a veterinarian before proceeding with behavioral interventions. Correct answer is B. To immediately begin developing a behavior modification plan for aggression, assuming the behavior is purely learned and not medically influenced. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal behavior consultant to navigate the complex and often subjective definition of animal behavior within the context of their professional scope. Misinterpreting this scope can lead to providing services outside of one's expertise, potentially harming the animal, misinforming the client, and violating professional standards. The IOP certification emphasizes a science-based approach, requiring consultants to clearly delineate what constitutes their professional domain versus areas that require referral to other professionals like veterinarians or legal experts. Correct approach analysis. The correct approach aligns with the IOP commitment to evidence-based practice and professional integrity. It recognizes that animal behavior, as a scope of practice for a certified consultant, encompasses observable actions, the underlying motivations and learning processes, and the environmental influences on these behaviors. This approach necessitates a thorough assessment of the animals presenting issues, considering their ethology, learning history, and environmental context to develop effective, humane, and scientifically sound intervention strategies. It also implicitly includes the ethical obligation to recognize the limits of one's expertise and refer to other professionals when necessary, such as for medical conditions that may manifest as behavioral issues. This aligns with the IOP ethical code, which prioritizes animal welfare and client education. Incorrect approaches analysis. One incorrect approach would be to define animal behavior solely as the observable actions of an animal, ignoring the underlying cognitive and emotional states learning history, and environmental factors. This narrow definition fails to capture the complexity of behavior and would lead to superficial interventions that do not address the root causes of issues. Ethically, this is problematic as it could result in ineffective or even detrimental advice, violating the IOP principle of promoting animal welfare. Another incorrect approach would be to include diagnosing and treating medical conditions that present as behavioral problems. While a behavior consultant must be aware of potential medical influences, the scope of practice for a certified behavior consultant does not include veterinary diagnostics or treatment. To do so would be practicing veterinary medicine without a license, a serious legal and ethical violation. This directly contravenes the IOP emphasis on working within one's defined professional boundaries and collaborating with other professionals. A third incorrect approach would be to focus exclusively on human-animal interaction without considering the animal's species-specific needs, natural behaviors, and individual learning history. While human-animal interaction is a crucial component of behavior modification, a comprehensive understanding of animal behavior requires a deep dive into the animal's intrinsic nature and how it learns and perceives its environment. This approach would be incomplete and could lead to interventions that are not species-appropriate or effective, potentially causing stress or welfare concerns for the animal. Professional reasoning. Professionals should approach the definition and scope of animal behavior by first consulting the IOP official documentation, including their code of ethics and certification standards. This provides the foundational understanding of what is expected. When faced with a client situation, the professional should conduct a comprehensive risk assessment, identifying potential behavioral issues, their likely causes, considering biological, psychological, and environmental factors, and the client's goals. Crucially, this assessment must include a determination of whether the presenting issues fall within the consultant's expertise or require referral to a veterinarian, a veterinary behaviorist, or another qualified professional. The decision-making process should always prioritize the animal's welfare, client safety, and adherence to professional and legal boundaries. Question 7. The performance metrics show a client's dog exhibiting frequent lip licking and yawning during recorded training sessions. Which of the following analytical approaches to this video evidence best aligns with the International Association of Animal Behavior Consultants Certification's ethical and professional standards? Option A. Focus on the frequency of lip licking and yawning as primary indicators of stress and immediately recommend a reduction in training session duration. Option B. Interpret the lip licking and yawning as normal, attention-seeking behaviors and advise the client to ignore them while continuing with the current training plan. Option C. Compare the observed behaviors to general canine behavioral norms without specific reference to the individual dog's training context or history. Option D. Analyze the video footage to identify specific antecedents and consequences associated with the lip licking and yawning, considering the dog's overall body language and the training environment. The correct answer is A. Focus on the frequency of lip licking and yawning as primary indicators of stress and immediately recommend a reduction in training session duration. Explanation. The performance metrics show a consistent pattern of a dog exhibiting displacement behaviors, such as lip licking and yawning, during training sessions. This scenario is professionally challenging because interpreting these subtle visual cues requires a nuanced understanding of canine ethology and the ability to differentiate between genuine stress signals and contextually appropriate behaviors. The IOP certification emphasizes evidence-based practices and ethical client communication, making accurate video analysis crucial for developing effective and humane training plans. The correct approach represents best professional practice because it prioritizes objective observation and a holistic understanding of the dog's emotional state. By meticulously reviewing video footage, the behavior consultant can identify the specific triggers for the displacement behaviors, assess their frequency and intensity, and correlate them with other observable behaviors. This detailed analysis allows for the development of a behavior modification plan that addresses the underlying causes of the dog's stress, rather than simply managing the outward signs. This aligns with IOP commitment to science-based, humane animal training and consulting, ensuring the welfare of the animal is paramount. An incorrect approach that focuses solely on the frequency of the displacement behaviors without considering the context or other behavioral indicators is ethically flawed. This could lead to misdiagnosis and the implementation of inappropriate interventions, potentially exacerbating the dog's stress or anxiety. For instance, if a consultant recommends aversive techniques based on a superficial interpretation of lip licking, they would be violating IOP ethical guidelines against the use of punishment that can cause fear, anxiety, or distress. Another incorrect approach might involve generalizing findings from one training scenario to all situations without sufficient video evidence, which lacks scientific rigor and could lead to ineffective or harmful recommendations. This fails to meet the IOP standard of evidence-based practice and could result in client dissatisfaction and harm to the animal. Professionals should employ a decision-making framework that begins with thorough data collection, including detailed video analysis. This should be followed by hypothesis generation regarding the function of the observed behaviors, considering all available contextual information. The next step involves developing and implementing a behavior modification plan based on scientific principles and ethical considerations, with ongoing monitoring and adjustment based on further observations and client feedback. This iterative process ensures that the consultant remains responsive to the animal's needs and adheres to the highest professional standards. Question 8. The audit findings indicate a concern that your understanding of historical perspectives on animal behavior may not be adequately integrated into your current consulting practices. Specifically, the auditor questions whether you can articulate the foundational contributions of early ethologists like Konrad Lorenz and Nico Timbergen and explain how their work informs, but does not solely dictate, your modern behavior modification strategies. How would you address this concern? Option A. Provide a detailed explanation of Konrad Lorenz's theories on instinct and aggression, asserting that these are the primary drivers of most animal behaviors and should be the sole basis for any intervention. Option B. Focus solely on the practical application of current training methods, such as positive reinforcement, without acknowledging the historical scientific context that led to the development and understanding of these methods. Option C. Explain how early ethological concepts, such as imprinting and fixed action patterns, provided the initial framework for understanding animal behavior, and detail how contemporary practices build upon these foundations by incorporating advanced learning theories, individual assessment, and environmental influences to create nuanced and effective intervention plans. Option D. State that historical theories are largely outdated and irrelevant to modern animal behavior consulting, and that your practice relies exclusively on the latest research and techniques without any regard for foundational scientific principles. The correct answer is C. Explain how early ethological concepts, such as imprinting and fixed action patterns, provided the initial framework for understanding animal behavior, and detail how contemporary practices build upon these foundations by incorporating advanced learning theories, individual assessment, and environmental influences to create nuanced and effective intervention plans. Explanation. Scenario analysis. This scenario presents a professional challenge where an auditor questions the historical context of an animal behavior consultant's practice, specifically regarding the application of early ethological theories. The consultant must demonstrate an understanding of how foundational concepts in animal behavior have evolved and how current practices are informed by, but not solely reliant on, these historical perspectives. The challenge lies in articulating the relevance of historical knowledge without appearing outdated or dismissive of contemporary research and ethical considerations. Correct approach analysis. The correct approach involves acknowledging the foundational contributions of early ethologists like Lorenz and Timbergen, recognizing their seminal work in establishing key concepts such as innate behaviors, imprinting, and fixed action patterns. It requires explaining how these early observations provided the bedrock for subsequent research, and how modern behavior consulting integrates these historical insights with more nuanced understandings of learning theory, individual variation, and the impact of environment and human interaction. This demonstrates a comprehensive understanding of the field's development and the consultant's ability to apply a historically informed, yet current, approach to behavior modification. This aligns with the IOP emphasis on evidence-based practices and a commitment to continuous learning and ethical application of knowledge, which implicitly requires understanding the lineage of that knowledge. Incorrect approaches analysis. One incorrect approach would be to dismiss historical perspectives entirely, claiming they are irrelevant to modern practice. This fails to acknowledge the scientific lineage and the foundational discoveries that paved the way for current understanding. Ethically, it suggests a lack of intellectual curiosity and a potential for overlooking fundamental principles that still hold some explanatory power, even if refined. It could also imply a superficial understanding of the field, which is detrimental to professional credibility. Another incorrect approach would be to rigidly adhere to outdated theories without acknowledging advancements. For instance, solely relying on instinctual explanations without considering learning, environmental factors, or individual differences would be a significant ethical and professional failing. This approach would likely lead to ineffective or even harmful interventions, violating the IOP commitment to animal welfare and evidence-based practice. It demonstrates a failure to engage with the evolution of scientific thought and a lack of critical evaluation of historical models against contemporary evidence. A third incorrect approach would be to misinterpret or misapply historical concepts, attributing behaviors solely to instinct without considering other contributing factors. This demonstrates a lack of depth in understanding the nuances of ethology and behavior science. Professionally, it can lead to misdiagnoses and inappropriate intervention strategies, undermining the consultant's expertise and potentially causing harm to the animal. Professional reasoning. Professionals should approach such inquiries by framing their practice within the historical development of animal behavior science. This involves understanding the seminal contributions of early researchers, recognizing how their work has been built upon, refined, or even challenged by subsequent research, and articulating how current practices synthesize historical knowledge with contemporary scientific findings and ethical guidelines. A commitment to lifelong learning and critical evaluation of scientific literature, both historical and current, is paramount. When faced with questions about historical perspectives, the decision-making process should involve 1. Identifying the core concepts being questioned. 2. Recalling the historical context and key figures associated with those concepts. 3. Evaluating the validity and limitations of those historical perspectives in light of current scientific understanding. 4. Articulating how current practices integrate or diverge from historical approaches, emphasizing evidence-based methodologies and ethical considerations for animal welfare. Question 9. Benchmark analysis indicates that a new puppy owner is hesitant to expose their 8-week-old Labrador puppy to any new environments or unfamiliar people due to concerns about parvovirus and other diseases, despite being advised by their veterinarian to begin socialization. The owner requests that the puppy remain strictly indoors and only interact with immediate family members for the next 2 months. As a certified animal behavior consultant, how should you advise this client, considering the critical period for canine socialization and habituation is rapidly closing? Option A. Advise the client to follow their veterinarian's recommendation for strict isolation until the puppy has received all vaccinations, as disease prevention is the absolute priority. Option B. Agree to the client's request to keep the puppy isolated indoors for 2 months, as their concerns about disease are valid and it is the client's decision. Option C. Inform the client that their concerns are unfounded and that they should immediately begin exposing the puppy to all possible environments and individuals without reservation. Option D. Explain the critical importance of early, positive exposure to a variety of sights, sounds, people, and other healthy, vaccinated animals during this developmental window to prevent future fear and reactivity, while also discussing strategies for safe socialization that mitigate disease risk. Correct answer is D. Explain the critical importance of early, positive exposure to a variety of sights, sounds, people, and other healthy, vaccinated animals during this developmental window to prevent future fear and reactivity, while also discussing strategies for safe socialization that mitigate disease risk. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a client's immediate desires and the long-term welfare of an animal, particularly when those desires might negatively impact critical developmental periods. The consultant must navigate the client's emotional investment and potential lack of understanding regarding the irreversible effects of early experiences on behavior. The ethical imperative to act in the animal's best interest, guided by scientific understanding of critical periods, clashes with the client's autonomy and expectations. Careful judgment is required to balance education, empathy, and professional responsibility. Correct approach analysis. The correct approach prioritizes the animal's welfare by educating the client about the scientific principles of critical periods in canine development and their implications for socialization and habituation. This aligns with the IOP ethical guidelines, which emphasize evidence-based practices and the consultant's responsibility to advocate for the animal's well-being. By explaining how early positive exposure during critical windows can prevent future fear-based or reactive behaviors, the consultant empowers the client with knowledge to make informed decisions that benefit the puppy. This approach is proactive, preventative, and rooted in the understanding that interventions during critical periods have a profound and lasting impact. It respects the client while firmly upholding professional standards and the scientific basis of behavior modification. Incorrect approaches analysis. One incorrect approach involves immediately agreeing to the client's request to isolate the puppy. This fails to acknowledge the critical period for socialization and habituation, which is typically between 3 and 16 weeks of age in puppies. Delaying or neglecting positive exposure during this time can lead to lifelong fear, anxiety, and reactivity towards unfamiliar people, environments, and other animals. This approach violates the ethical obligation to provide advice that promotes the animal's welfare and can be considered negligent, as it knowingly risks detrimental developmental outcomes. Another incorrect approach is to dismiss the client's concerns about potential disease transmission without providing a balanced perspective. While biosecurity is important, an absolute avoidance of all social interaction during critical periods is not scientifically supported as the best practice for healthy development. The ethical failure here lies in not offering evidence-based strategies for safe socialization, such as controlled introductions to vaccinated, healthy dogs and limited, supervised exposure to varied environments. This approach prioritizes a perceived, but not absolute, risk over the well-documented developmental needs of the puppy. A third incorrect approach is to simply state that the client is wrong without offering an alternative or explanation. This is unprofessional and counterproductive. It fails to educate the client, potentially alienating them and undermining the consultant's credibility. Ethically, consultants are expected to guide and educate, not to dictate without justification. This approach neglects the crucial element of client education and collaboration, which is essential for successful behavior modification and maintaining a positive professional relationship. Professional reasoning. Professionals should approach such situations by first actively listening to and validating the client's concerns. Then, they must clearly and empathetically explain the scientific principles at play, specifically focusing on the concept of critical periods and their impact on the animal's future behavior. This education should be coupled with practical, evidence-based recommendations for managing risks while still facilitating necessary developmental experiences. The decision-making process involves weighing the potential risks and benefits of different approaches, always prioritizing the animal's long-term welfare as dictated by scientific understanding and ethical guidelines. Transparency, education, and collaborative problem-solving are key to navigating these ethical dilemmas effectively. Question 10. Market research demonstrates that clients often seek guidance on managing their dog's interactions in public spaces. A client reports that their two dogs, a young Labrador Retriever and an older Border Collie, frequently engage in boisterous play that sometimes escalates into what the client perceives as arguments. The client is concerned about the safety and appropriateness of these interactions. Which of the following approaches best addresses this situation according to best practices in canine behavior consulting? Option A. Observe multiple play sessions between the dogs in various public settings, meticulously documenting their body language, vocalizations, play bows, appeasement signals, and the duration and intensity of their interaction to understand their social dynamics and communication patterns before formulating recommendations. Option B. Immediately advise the client to separate the dogs whenever their play becomes too energetic, as this is a clear indication of dominance struggles that need to be curtailed to prevent future conflicts. Option C. Suggest that the client enroll both dogs in advanced obedience classes, assuming that improved obedience will naturally resolve any underlying social tension and prevent escalation. Option D. Interpret the escalating play as a sign of the Labrador Retriever's disrespect for the Border Collie's authority, and recommend that the client implement a strict alpha role technique to establish clear dominance hierarchy. The correct answer is A. Observe multiple play sessions between the dogs in various public settings, meticulously documenting their body language, vocalizations, play bows, appeasement signals, and the duration and intensity of their interactions to understand their social dynamics and communication patterns before formulating recommendations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the consultant to interpret complex canine social dynamics and communication signals within the context of a potentially stressful and unpredictable environment. Misinterpreting these signals could lead to ineffective or even harmful interventions, impacting the welfare of the dogs and the satisfaction of the client. The consultant must balance the need for accurate behavioral assessment with the practical realities of a public space and the client's expectations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the dog's social structure, communication, and play behaviors in their natural environment. This aligns with the IOP commitment to ethical and effective animal behavior consulting, which emphasizes understanding the individual animal and its context. By observing multiple interactions and considering various communication modalities, body language, vocalizations, play bows, etc., the consultant can form a comprehensive understanding of the social dynamics at play. This approach is ethically sound as it avoids premature assumptions and focuses on gathering objective data to inform recommendations, thereby promoting the welfare of the animals involved and ensuring client trust through a scientifically grounded methodology. Incorrect approach is analysis. One incorrect approach involves immediately recommending specific training exercises based on a superficial observation of a single interaction. This fails to consider the nuances of canine social structure and communication. Ethically, it is a failure to conduct a proper assessment, potentially leading to inappropriate interventions that could exacerbate existing issues or create new ones. It bypasses the professional obligation to understand the root cause of behaviors. Another incorrect approach is to attribute human emotions or intentions to the dog's behaviors without sufficient evidence. This anthropomorphism can lead to misinterpretations of social cues and play dynamics, hindering effective behavior modification. From a professional and ethical standpoint, this is a failure to adhere to scientifically validated principles of animal behavior, potentially misleading the client and compromising the welfare of the dogs. A third incorrect approach is to focus solely on the client's description of the problem without independent observation. While client input is valuable, it is not a substitute for direct behavioral assessment. Relying solely on subjective reports can lead to biased conclusions and recommendations that do not accurately address the underlying behavioral issues. This represents a failure in due diligence and professional responsibility to gather objective data. Professional reasoning. Professionals should employ a systematic observational approach. This involves 1. Gathering a detailed history from the client. 2. Conducting direct, objective observations of the dogs in their relevant environment, noting social interactions, communication signals, and play styles. 3. Analyzing these observations through the lens of established canine ethology and behavior science. 4. Developing a behavior modification plan based on this comprehensive assessment, prioritizing the welfare of the animals and the client's goals. This structured process ensures that recommendations are informed, ethical, and effective. Question 11. Assessment of how an animal behavior consultant should integrate neurobiological research into their practice when addressing complex behavioral issues, considering the ethical imperative to prioritize animal welfare and adhere to evidence-based methodologies. Option A. Make definitive diagnoses of neurological disorders based on behavioral observations and general neurobiological knowledge, recommending specific pharmaceutical interventions without veterinary consultation. Option B. Propose interventions based on speculative or unproven neurobiological theories that have gained recent popular attention, prioritizing novelty over established efficacy. Option C. Conduct a thorough behavioral assessment, integrate relevant and established neurobiological research to inform understanding, and develop welfare-focused behavior modification plans. Option D. Solely focus on identifying neurobiological correlates of the observed behavior without a comprehensive behavioral assessment, assuming these correlates directly dictate the intervention strategy. The correct answer is C. Conduct a thorough behavioral assessment, integrate relevant and established neurobiological research to inform understanding, and develop welfare-focused behavior modification plans. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an animal behavior consultant to interpret complex neurobiological findings in the context of a specific animal's behavior, and to translate these findings into actionable, ethical, and effective behavior modification plans. The challenge lies in bridging the gap between scientific understanding of neural mechanisms and practical application in a real-world setting, ensuring that interventions are not only scientifically sound, but also prioritize the animal's welfare and adhere to professional standards. The consultant must also consider the limitations of current neurobiological knowledge and avoid oversimplification or misinterpretation. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a holistic and evidence-based methodology. It begins with a thorough behavioral assessment, which is the cornerstone of ethical animal behavior consulting. This assessment provides the essential baseline data against which any neurobiological considerations are evaluated. The subsequent integration of relevant neurobiological research, focusing on established principles and their potential influence on the observed behaviors, allows for a more nuanced understanding. Crucially, this approach emphasizes the development of behavior modification plans that are grounded in both behavioral science and neurobiological insights, always prioritizing the animal's welfare and safety. This aligns with the IOP commitment to science-based, humane practices and the ethical responsibility to provide effective, welfare-focused interventions. Incorrect approach is analysis. One incorrect approach fails by solely focusing on neurobiological correlates without a foundational behavioral assessment. This is a significant ethical and professional failure because it risks misinterpreting or overemphasizing neurobiological factors, potentially leading to inappropriate or ineffective interventions. Without understanding the animal's specific behavioral repertoire, environmental influences, and learning history, any conclusions drawn from neurobiology are speculative and could lead to harm. This approach neglects the fundamental principle of individualized assessment, which is critical for ethical practice. Another incorrect approach is to propose interventions based on speculative or unproven neurobiological theories. This is professionally unacceptable as it deviates from evidence-based practice, a core tenet of the IOC. Relying on fringe or unsubstantiated neurobiological claims can lead to ineffective or even detrimental outcomes for the animal, violating the consultant's duty of care and potentially causing distress or harm. This approach prioritizes novelty or unverified hypotheses over established scientific understanding and proven behavioral modification techniques. A third incorrect approach involves making definitive diagnoses of neurological disorders based solely on behavioral observations and general neurobiological knowledge, without the involvement of a qualified veterinarian or veterinary neurologist. This oversteps the scope of practice for an animal behavior consultant and is a serious ethical breach. Behavior consultants are not licensed to diagnose medical conditions. Such an approach could delay proper veterinary diagnosis and treatment, potentially exacerbating the animal's condition and compromising its welfare. It also misrepresents the consultant's expertise and responsibilities. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive behavioral assessment to gather objective data on the animal's behavior, history, and environment. This assessment serves as the foundation for all subsequent analysis. Next, they should consult peer-reviewed scientific literature to understand the neurobiological underpinnings of the observed behaviors, focusing on well-established research and avoiding speculative theories. Any neurobiological insights should be integrated with the behavioral data to inform the development of a behavior modification plan that is humane, effective, and tailored to the individual animal's needs. Collaboration with veterinary professionals is essential when medical or neurological issues are suspected. This systematic, evidence-based, and welfare-focused approach ensures ethical practice and optimal outcomes for the animal. Question 12. Comparative studies suggest that while some clients may express a preference for anecdotal or traditional methods of understanding animal behavior, scientifically validated behavioral assessment techniques are crucial for accurate diagnosis and effective intervention. A client, deeply influenced by a family tradition, insists on using a specific, unvalidated method to assess their dog's anxiety, believing it to be highly accurate. This method involves interpreting the dog's ear twitches in a highly specific, non-standardized manner. As a certified animal behavior consultant, you have concerns about the scientific validity and reliability of this approach for diagnosing anxiety. How should you ethically and professionally proceed? Option A. Agree to incorporate the client's preferred method into the assessment, perhaps by observing ear twitches alongside other behaviors, to maintain client rapport and ensure they feel heard. Option B. Gently explain that while you understand their family tradition, the method they are suggesting is not supported by scientific research and may not accurately reflect the dog's emotional state. Offer to conduct a comprehensive, evidence-based behavioral assessment using established protocols and discuss the findings and appropriate interventions based on that assessment. Option C. Acknowledge the client's belief in their family tradition and proceed with their requested assessment method, focusing on interpreting the ear twitches as they have described, to avoid conflict and ensure client satisfaction. Option D. Politely inform the client that their chosen method is unscientific and that you cannot proceed with their request, suggesting they seek advice elsewhere if they are unwilling to use scientifically validated techniques. The correct answer is B. Gently explain that while you understand their family tradition, the method they are suggesting is not supported by scientific research and may not accurately reflect the dog's emotional state. Offer to conduct a comprehensive, evidence-based behavioral assessment using established protocols and discuss the findings and appropriate interventions based on that assessment. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's deeply held beliefs and the scientifically validated principles of animal behavior assessment. The consultant must navigate this ethical minefield by prioritizing the animal's welfare and the integrity of their professional practice, even when it may lead to client dissatisfaction. The correct approach represents best professional practice because it adheres to the core ethical principles of the International Association of Animal Behavior Consultants, IABC. Specifically, it upholds the commitment to evidence-based practices and the welfare of the animal as the paramount concern. By explaining the limitations of the client's preferred method and offering scientifically supported alternatives, the consultant demonstrates professional integrity and a commitment to providing effective, ethical guidance. This aligns with IABC's emphasis on using scientifically validated assessment techniques and prioritizing the animal's well-being over client convenience or unsupported beliefs. An incorrect approach that dismisses the client's beliefs outright without offering a reasoned explanation or alternative would be ethically problematic. It fails to acknowledge the client's perspective, potentially damaging the professional relationship and hindering the client's willingness to engage with recommended interventions. This could be seen as a failure to uphold the principle of client communication and collaboration, even when disagreeing with their proposed methods. Another incorrect approach that involves fabricating or misrepresenting scientific data to appease the client would be a severe ethical violation. This undermines the credibility of the profession and directly contravenes the IABC commitment to honesty and scientific integrity. Such deception would not only harm the animal by leading to ineffective or detrimental interventions, but also expose the consultant to professional repercussions. Further incorrect approach that involves agreeing to use a scientifically unsupported method without clearly communicating its limitations and potential ineffectiveness is also ethically unsound. While appearing to accommodate the client, this approach fails to provide responsible guidance and could lead to the animal not receiving appropriate care, thus compromising its welfare. It represents a failure to act in the best interest of the animal and a lack of transparency with the client. The professional decision-making process in such situations requires a structured approach. First, actively listen to and acknowledge the client's concerns and beliefs. Second, clearly and respectfully explain the scientific basis for recommended assessment techniques, highlighting their efficacy and ethical considerations. Third, offer evidence-based alternatives that address the client's underlying goals while prioritizing the animal's welfare. Fourth, document all discussions and recommendations thoroughly. Finally, be prepared to respectfully decline services if the client insists on methods that are demonstrably harmful or unethical. Question 13. Market research demonstrates that clients often seek rapid resolution for their pets' behavioral issues, sometimes pressuring consultants to adopt quicker, albeit potentially less humane, training methods. Considering the IOP emphasis on ethical and science-based practices, which of the following approaches best navigates this client expectation while upholding professional standards and prioritizing the animal's cognitive well-being? Option A. Immediately implement a strict regimen of punishment-based techniques to quickly suppress the unwanted behavior, assuring the client that this is the fastest way to achieve compliance. Option B. Agree to the client's suggested quick-fix solution, even if it involves methods the consultant is uncomfortable with, to maintain client satisfaction and avoid potential conflict. Option C. Focus solely on superficial behavioral management techniques that mask the problem without addressing the animal's cognitive state or learning history, promising a quick but temporary fix. Option D. Develop a comprehensive behavior modification plan that addresses the underlying cognitive processes of the behavior, educates the client on realistic timelines and the rationale behind the chosen methods, and emphasizes positive reinforcement and management strategies. Correct answer is D. Develop a comprehensive behavior modification plan that addresses the underlying cognitive processes of the behavior, educates the client on realistic timelines and the rationale behind the chosen methods, and emphasizes positive reinforcement and management strategies. Explanation. Scenario analysis. This scenario presents a common challenge for animal behavior consultants, balancing client expectations with scientifically sound, ethical, and legally compliant practices. Clients often seek quick fixes, but effective behavior modification requires understanding the underlying cognitive processes of the animal and employing methods that are humane and evidence-based. The challenge lies in educating the client about realistic timelines and appropriate interventions, while maintaining professional integrity and adhering to the IOP ethical code and any relevant local animal welfare legislation. The consultant must navigate potential pressure from the client for faster results, which could lead to the temptation of using less ethical or effective methods. Correct approach analysis. The correct approach prioritizes the animal's welfare and employs scientifically validated learning principles. This involves a thorough assessment of the animal's history, environment, and current behavior, followed by the development of a behavior modification plan that targets the specific cognitive processes involved in the unwanted behavior. This might include classical and operant conditioning, desensitization, counter-conditioning, and management strategies. This approach aligns with the IOP commitment to humane, science-based methods and upholds the ethical obligation to avoid causing harm or distress to the animal. It also respects the client's role in the process by providing education and support, fostering a collaborative relationship built on trust and realistic expectations. This method is also compliant with general animal welfare principles that underpin professional practice, ensuring that interventions are not only effective but also ethically sound. Incorrect approaches analysis. One incorrect approach involves solely relying on aversive techniques or punishment-based methods. This is ethically problematic as it can cause fear, anxiety, and stress in the animal, potentially leading to new behavioral issues or aggression. It fails to address the underlying cognitive reasons for the behavior and can damage the human-animal bond. From a regulatory and ethical standpoint, such methods often violate principles of animal welfare and can be considered abusive under various animal protection laws, even if not explicitly detailed in IOP-specific exam jurisdiction. Another incorrect approach is to implement a plan without a thorough assessment or understanding of the animal's cognitive state and learning history. This can lead to ineffective or even counterproductive interventions. It demonstrates a lack of professional due diligence and can result in wasted time and resources for the client, as well as continued distress for the animal. Ethically, it breaches the duty of care owed to both the client and the animal. A third incorrect approach might be to overpromise rapid results without considering the animal's individual learning pace and the complexity of the cognitive processes involved. This sets unrealistic expectations for the client and can lead to frustration and abandonment of the behavior modification plan. It is a failure to manage client expectations responsibly and can be seen as a form of professional misrepresentation. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive assessment to understand the animal's cognitive processes and the factors contributing to the behavior. This forms the foundation for an individualized, humane, and evidence-based behavior modification plan. Client education is paramount, clearly explaining the rationale behind the plan, the expected timeline, and the importance of consistency is crucial for successful outcomes and client satisfaction. Professionals must maintain ethical boundaries, refusing to employ methods that are harmful or ineffective, and always prioritizing the animal's welfare. Regular reassessment and adjustment of the plan based on the animal's progress are also key components of best practice. This systematic, ethical, and client-centered approach ensures both professional integrity and positive outcomes for the animal. Question 14. To address the challenge of a client reporting their young dog exhibiting destructive chewing when left alone, which is suspected to be linked to a lack of appropriate outlets for natural behaviors, what is the most ethically and developmentally sound approach for an IOB-certified animal behavior consultant to recommend regarding the role of play in the dog's behavioral development? Option A. Suggest that the dog is simply being naughty and recommend using aversive training methods, such as startling noises or physical corrections, whenever the destructive chewing is discovered upon the client's return. Option B. Educate the client on the critical role of varied play in a young dog's development, including its benefits for cognitive stimulation, impulse control, and social bonding, and recommend incorporating structured play sessions and appropriate chew toys as a primary strategy to redirect chewing behaviors and promote overall well-being. Option C. Focus solely on providing the client with a detailed academic paper on the evolutionary history of canid play, without offering specific, actionable strategies tailored to the client's dog and situation. Option D. Advise the client to immediately confine the dog to a small crate for extended periods when unsupervised to prevent any opportunity for destructive chewing, and to only allow the dog out for brief, controlled interactions. The correct answer is B. Educate the client on the critical role of varied play in a young dog's development, including its benefits for cognitive stimulation, impulse control, and social bonding, and recommend incorporating structured play sessions and appropriate chew toys as a primary strategy to redirect chewing behaviors and promote overall well-being. Explanation. The scenario presents a professional challenge because it requires an animal behavior consultant to balance the immediate needs of a client with the long-term behavioral development of an animal, specifically concerning the role of play. The client's desire for a quick fix for perceived destructive behavior, which may stem from a lack of appropriate outlets like play, necessitates a nuanced approach that educates the client on developmental needs rather than simply suppressing symptoms. Careful judgment is required to ensure the recommendations are ethically sound, scientifically supported, and align with the IOP commitment to animal welfare and evidence-based practice. The correct approach represents best professional practice because it prioritizes the animal's developmental needs, recognizing play as a crucial component of healthy behavioral development. This aligns with IOP ethical guidelines, which emphasize understanding the underlying causes of behavior and promoting well-being. By educating the client on the importance of play for socialization, problem-solving skills, and stress reduction, the consultant is providing a holistic and sustainable solution that addresses the root of the issue, rather than a superficial fix. This approach fosters a stronger human-animal bond and promotes responsible pet ownership, which are core tenets of professional animal behavior consulting. An incorrect approach that focuses solely on immediate cessation of the behavior without addressing the underlying developmental need for play would be professionally unacceptable. This would represent a failure to adhere to IOP ethical principles of promoting animal welfare and using science-based methods. Such an approach could lead to the suppression of natural behaviors, potentially causing increased stress, anxiety, or the emergence of other, more severe behavioral problems. It also fails to educate the client, perpetuating a cycle of misunderstanding and potentially leading to further welfare concerns. Another incorrect approach that involves recommending punitive measures to stop the behavior would be a significant ethical and regulatory failure. Punitive methods are often counterproductive, can damage the human-animal bond, and can lead to fear, aggression, and other negative behavioral outcomes. IOP strongly advocates against the use of aversive techniques, and recommending them would be a direct violation of ethical guidelines and best practices in animal behavior consulting. This approach ignores the developmental role of play and focuses on control rather than understanding and positive reinforcement. A third incorrect approach that dismisses the client's concerns and insists on a purely academic discussion of play without practical application would also be professionally deficient. While scientific understanding is crucial, effective consulting requires translating that knowledge into actionable advice that the client can implement. Failing to connect the theoretical importance of play to the client's specific situation and the observed behavior would be a failure to provide adequate support and guidance, potentially leaving the client frustrated and the animal's needs unmet. The professional decision-making process for similar situations should involve a thorough assessment of the animal's behavior, environment, and developmental stage. This assessment should then inform an educational approach that clearly explains the scientific rationale behind recommended interventions, particularly concerning the role of play. The consultant must then work collaboratively with the client to develop a practical, humane, and effective plan that addresses both the immediate behavioral concerns and the animal's long-term developmental needs, always prioritizing the animal's welfare and adhering to the ethical standards of the IOP. Question 15. Operational review demonstrates that a long-term client is concerned about their 12-year-old Labrador Retriever, who has recently begun exhibiting increased vocalization at night, house soiling incidents, and a decreased interest in previously enjoyed activities. The client believes these changes are simply due to the dog's advanced age. What is the most appropriate initial course of action for an animal behavior consultant to recommend? Option A. Suggest that the behavioral changes are a normal part of aging and that the client should focus on managing the symptoms without further investigation. Option B. Recommend a thorough veterinary examination to rule out underlying medical conditions contributing to the behavioral changes. Option C. Advise the client to simply increase the dog's daily exercise and provide more toys to distract from the new behaviors. Option D. Immediately design a comprehensive environmental enrichment program and advanced training exercises to address the perceived behavioral issues. The correct answer is B. Recommend a thorough veterinary examination to rule out underlying medical conditions contributing to the behavioral changes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal behavior consultant to assess and address a client's concerns about a dog's behavioral regression, which is a common manifestation of age-related changes. The challenge lies in differentiating between normal aging processes, potential underlying medical issues, and behavioral problems that require intervention. A failure to accurately assess the lifespan stage and its impact can lead to inappropriate or ineffective interventions, potentially causing distress to the animal and client. Correct approach analysis. The correct approach involves a comprehensive assessment that prioritizes ruling out medical causes for the behavioral changes. This aligns with best professional practice as outlined by the International Association of Animal Behavior Consultants, IOP, ethical guidelines, which emphasize the welfare of the animal. Specifically, IOP principles advocate for a holistic approach that considers all potential contributing factors to behavior. By recommending a veterinary examination first, the consultant ensures that any underlying physical ailments, which can significantly impact behavior, are identified and treated. This proactive step is crucial for ethical practice, as it prevents the application of behavioral modification techniques to symptoms that are medically rooted, which would be ineffective and potentially harmful. Incorrect approaches analysis. One incorrect approach is to immediately implement advanced behavior modification techniques without first consulting a veterinarian. This fails to adhere to the IOP ethical mandate to prioritize animal welfare. It is a regulatory and ethical failure because it bypasses the critical step of medical assessment, potentially leading to the misapplication of training methods to a condition that requires veterinary care. This could exacerbate the animal's distress and delay appropriate treatment. Another incorrect approach is to attribute the changes solely to the dog's age and advise the owner to simply manage the behavior without further investigation. While age is a factor, this approach is ethically problematic as it dismisses the possibility of treatable medical conditions or behavioral issues that could be improved with appropriate intervention. It represents a failure to conduct a thorough impact assessment and a potential neglect of the animal's well-being by not exploring all avenues for improvement. A third incorrect approach is to focus exclusively on environmental enrichment and training exercises, ignoring the possibility of underlying medical or age-related cognitive decline. This is an ethical failure because it prioritizes a single category of intervention without a comprehensive diagnostic process. It risks overlooking significant health issues that could be contributing to the behavioral changes, thereby failing to provide the most effective and humane care. Professional reasoning. Professionals should adopt a systematic approach. First, gather detailed history from the client, including the onset, duration, and specific nature of the behavioral changes. Second, conduct a thorough observation of the animal and its environment. Third, and critically, recommend a veterinary consultation to rule out any underlying medical conditions. Following medical clearance, or concurrently with medical management, develop a behavior modification plan that is tailored to the individual animal's needs, considering its age, breed, history, and the specific behavioral changes observed. This layered approach ensures that all potential causes are addressed, prioritizing the animal's health and welfare, and adhering to professional ethical standards. Question 16. Stakeholder feedback indicates that a 12-week-old Labrador puppy is exhibiting frequent mouthing, nipping, and jumping behaviors, particularly during play and when excited. The owners are becoming increasingly frustrated and concerned that these behaviors will become permanent and are seeking immediate solutions to stop them entirely. They have heard about various training methods and are eager for the consultant to provide a definitive plan. Option A. Recommend a series of advanced obedience classes focused on impulse control and immediate compliance, with the expectation that rigorous training will eliminate all puppy-like behaviors. Option B. Advise the owners that these are normal puppy behaviors that will likely resolve on their own with time, and suggest they simply ignore the behaviors until the puppy matures. Option C. Conduct a comprehensive behavioral assessment, observing the puppy's interactions and environment, to determine if the behaviors are typical developmental stages or indicative of underlying issues, and then develop a tailored management and training plan focusing on redirection and positive reinforcement. Option D. Immediately implement a strict no-tolerance policy, using leash corrections and verbal reprimands every time the puppy mouths, nips, or jumps, to quickly suppress these behaviors before they become ingrained habits. The correct answer is C. Conduct a comprehensive behavioral assessment, observing the puppy's interactions and environment, to determine if the behaviors are typical developmental stages or indicative of underlying issues, and then develop a tailored management and training plan focusing on redirection and positive reinforcement. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a young animal exhibiting behaviors that, while potentially normal developmental stages, are causing significant distress to the owners and impacting the dog's integration into the household. The consultant must balance the owner's immediate concerns with the animal's developmental needs and the long-term welfare of both. Misinterpreting developmental stages can lead to inappropriate interventions, potentially exacerbating the problem or causing harm. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough, individualized assessment of the puppy's developmental stage and environmental influences. This aligns with the IOPC ethical guidelines, which emphasize evidence-based practices and a commitment to the welfare of the animal. By observing the puppy in its natural environment and gathering detailed history, the consultant can accurately identify whether the behaviors are transient developmental phases or indicative of underlying issues requiring intervention. This approach respects the animal's species-specific needs and avoids premature or unnecessary interventions that could disrupt healthy development. It also empowers owners with understanding and appropriate management strategies, fostering a positive human-animal bond. Incorrect approaches analysis. One incorrect approach involves immediately recommending intensive obedience training focused on suppression of the behaviors. This fails to acknowledge that many behaviors in young animals are part of normal developmental exploration and learning. Such an approach could be ethically problematic by imposing adult expectations on a developing animal, potentially leading to stress, anxiety, or learned helplessness if the underlying developmental need is not met. It bypasses the crucial step of understanding the why behind the behavior. Another incorrect approach is to dismiss the owner's concerns outright, stating that the behaviors are just puppy stuff and will resolve on their own. While some puppy behaviors are transient, this dismissive attitude can be ethically negligent. It fails to acknowledge the owner's distress and the potential for these behaviors to escalate or indicate underlying issues that require guidance. It also neglects the consultant's professional responsibility to provide support and education, potentially damaging the client relationship and the animal's welfare if intervention is indeed needed. Third incorrect approach is to immediately suggest aversive training techniques to quickly correct the behaviors. This is a significant ethical failure. IOP principles strongly advocate for positive reinforcement and humane training methods. Aversive techniques can suppress behavior without addressing the root cause, lead to fear and anxiety, damage the human-animal bond, and potentially result in aggression. This approach disregards the animal's emotional state and well-being, which is paramount in professional animal behavior consulting. Professional reasoning. Professionals should approach such situations by first establishing a strong rapport with the stakeholders, acknowledging their concerns. The decision-making process should then involve a systematic assessment, gathering a comprehensive history, observing the animal in its environment, and considering the animal's age and species-typical developmental milestones. Based on this holistic assessment, the professional can then formulate a behavior modification plan that is humane, effective, and tailored to the individual animal and its environment, always prioritizing the animal's welfare and the client's understanding and capacity to implement the plan. Question 17. Strategic planning requires an animal behavior consultant to analyze a client's report of their dog exhibiting a new, undesirable behavior after interacting with a neighbor's dog. The client describes the dog watching the neighbor's dog perform a specific action, e.g., digging in a particular spot, and then subsequently performing the same action. The consultant must determine the most appropriate theoretical framework to guide their assessment and intervention. Which of the following approaches best reflects a strategic application of behavioral theory to this scenario? Option A. Conclude that the behavior is purely instinctual and recommend management strategies to prevent the dog from accessing areas where the behavior is likely to occur. Option B. Consider the principles of social learning theory, specifically observational learning and potential imitation, as the primary driver of the behavior and develop an intervention that addresses these mechanisms. Option C. Recommend immediate punishment for the undesirable behavior, assuming it is a learned response that needs to be suppressed quickly. Option D. Focus on identifying if the dog is being directly reinforced for the new behavior and design an intervention based on operant conditioning principles. The correct answer is D. Focus on identifying if the dog is being directly reinforced for the new behavior and design an intervention based on operant conditioning principles. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an animal behavior consultant to apply a theoretical framework, social learning theory, to a practical, real-world situation involving a client's pet. The challenge lies in accurately identifying instances of social learning, distinguishing them from other learning mechanisms, and then developing an intervention plan that is both effective and ethically sound, adhering to the IOP ethical guidelines. The consultant must also consider the client's understanding and ability to implement the plan, ensuring it aligns with the principles of humane training and welfare. Correct approach analysis. The correct approach demonstrates best professional practice by directly applying the principles of social learning theory to the observed behavior. It involves identifying the specific elements of social learning observation, imitation, and reinforcement in the dog's behavior. This approach is ethically justified as it is grounded in scientific understanding of animal behavior and aims to create positive outcomes for the animal by leveraging natural learning processes. It also aligns with IOP commitment to evidence-based practices and the welfare of animals. The consultant is focusing on understanding the asterisk mechanism asterisk of learning to inform the intervention, which is a hallmark of professional expertise. Incorrect approaches analysis. One incorrect approach fails by oversimplifying the situation and attributing the behavior solely to direct reinforcement without considering observational learning. This is an ethical failure because it ignores a significant potential mechanism of behavior acquisition, leading to an incomplete or ineffective intervention plan. It also risks misdiagnosing the root cause of the behavior, potentially leading to frustration for both the client and the animal. Another incorrect approach is to dismiss the possibility of social learning entirely and focus only on individual conditioning. This is a regulatory and ethical failure because it demonstrates a lack of comprehensive understanding of animal behavior principles, which the IOP certification implies. It limits the consultant's toolkit and may lead to suboptimal or even detrimental advice if social learning is indeed a primary driver of the behavior. A third incorrect approach might involve recommending interventions that are not supported by social learning theory or that could inadvertently reinforce undesirable observational learning. This is an ethical failure as it could lead to unintended negative consequences for the animal's behavior and welfare, violating the principle of do no harm. It also fails to leverage the most appropriate theoretical framework for understanding and modifying the behavior. Professional reasoning. Professionals should approach such situations by first conducting a thorough behavioral assessment, gathering detailed history from the client, and observing the animal in its environment. They should then consider all relevant learning theories, including social learning, operant conditioning, and classical conditioning, to form a comprehensive understanding of the behavior. The intervention plan should be developed based on the most likely learning mechanisms, prioritizing humane and evidence-based methods. Continuous evaluation of the plan's effectiveness and adjustment as needed are crucial components of professional practice. When in doubt, consulting with peers or seeking further education on specific behavioral principles is also a sign of professional maturity. Question 18. Consider a scenario where a client reports their dog exhibiting sudden aggression towards visitors, expressing significant distress and fear about the dog's behavior and its potential impact on their social life. The client is eager for a quick fix and suggests the dog might be mean and should be punished to deter future incidents. As an IOB-certified animal behavior consultant, how should you approach the initial consultation and assessment to best serve the animal and the client? Option A. Immediately reassure the client that the dog's behavior is likely a phase and suggest simple obedience commands to manage the situation, focusing on calming the client's immediate anxieties. Option B. Focus primarily on the client's emotional state and social concerns, suggesting they limit visitors temporarily while you research common dog breeds known for aggression to provide general advice. Option C. Conduct a detailed behavioral history interview. Observe the dog's interactions with visitors in a controlled setting, and gather objective data on the aggression to identify potential triggers and underlying causes before proposing any intervention strategies. Option D. Advise the client that the dog's behavior is unacceptable and recommend immediate, severe punishment methods to establish dominance and control, as this is the fastest way to resolve the issue. The correct answer is C. Conduct a detailed behavioral history interview, observe the dog's interactions with visitors in a controlled setting, and gather objective data on the aggression to identify potential triggers and underlying causes before proposing any intervention strategies. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's emotional attachment to their pet and the objective assessment of the animal's welfare and behavioral needs. The consultant must navigate this delicate balance while adhering to the ethical guidelines and professional standards set forth by the International Association of Animal Behavior Consultants, IOB. The core of the challenge lies in providing an accurate and actionable behavioral assessment that prioritizes the animal's well-being, even if it means delivering information that may be difficult for the client to accept. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that considers all relevant factors, including the animal's history, environment, and observable behaviors. This aligns with the IOB commitment to promoting humane and effective animal behavior modification techniques, which are rooted in scientific understanding and ethical treatment. By focusing on objective data collection and a thorough analysis of the underlying causes of the behavior, the consultant can develop a tailored intervention plan that addresses the animal's needs and improves the human-animal bond in a sustainable way. This approach also upholds the principle of client education, empowering the owner with the knowledge and tools to manage the behavior effectively. An incorrect approach that focuses solely on the client's immediate emotional distress without a thorough behavioral assessment would be a significant ethical failure. This would neglect the primary responsibility of the consultant, which is to the welfare of the animal. It could lead to ineffective or even harmful interventions, perpetuating the problem and potentially exacerbating the animal's distress or the risk to the household. Another incorrect approach, such as immediately recommending drastic measures like rehoming without exploring all possible behavioral interventions, would also be ethically problematic. This bypasses the consultant's duty to explore less intrusive and more humane solutions first, failing to uphold the IOB emphasis on positive reinforcement and welfare-focused strategies. A third incorrect approach, which involves making assumptions about the behavior based on anecdotal evidence or personal biases rather than systematic observation and data collection, would violate the scientific integrity expected of a certified professional. This could lead to misdiagnosis and inappropriate recommendations, ultimately harming both the animal and the client. Professional decision-making in such situations requires a systematic process. First, the consultant must establish clear communication with the client, setting expectations for the assessment process and emphasizing the focus on the animal's welfare. Second, a thorough history must be gathered, followed by direct observation of the animal in its natural environment. Third, data should be collected objectively, noting frequency, duration, and triggers of the behavior. Fourth, the consultant must analyze this data to identify potential underlying causes, considering biological, environmental, and learned factors. Finally, based on this comprehensive assessment, a humane and effective intervention plan should be developed, clearly communicated to the client, and followed up on to ensure progress and adjust strategies as needed. Question 19. The investigation demonstrates that a group of laboratory rats exhibits increased piloerection and reduced social grooming, alongside a tendency for some individuals to hoard food resources more aggressively than others. Which approach best reflects a comprehensive evaluation of their foraging, social structures, and communication to inform welfare recommendations? Option A. Focus solely on increasing the quantity of food provided, as hoarding behavior suggests a primary deficiency in food availability, and disregard other behavioral observations. Option B. Recommend immediate separation of the most aggressive food hoarders to reduce competition, assuming piloerection and reduced grooming are direct responses to this specific conflict. Option C. Conduct a detailed observational study of foraging patterns, social interactions including subtle dominance displays and affiliative behaviors, and analyze the context and frequency of piloerection and vocalizations to understand the interplay of these factors in their social dynamics. Option D. Interpret piloerection and reduced grooming as universal signs of fear, and implement a general desensitization program without investigating the specific social hierarchy or foraging strategies that might be contributing to these behaviors. The correct answer is B. Recommend immediate separation of the most aggressive food hoarders to reduce competition, assuming piloerection and reduced grooming are direct responses to this specific conflict. Explanation. Scenario analysis. This scenario presents a common challenge in animal behavior consulting, interpreting complex rodent social dynamics and communication patterns to inform effective welfare interventions. Rodents, often perceived as simple creatures, exhibit nuanced foraging strategies, intricate social hierarchies, and sophisticated communication methods that are crucial for their well-being. Misinterpreting these behaviors can lead to inappropriate housing, inadequate enrichment, and ultimately compromised welfare, which is a direct concern for IOPC certification standards. The challenge lies in moving beyond anthropomorphic assumptions and applying species-specific knowledge grounded in scientific observation and ethical practice. Correct approach analysis. The correct approach involves a comprehensive evaluation of the rodent's environment, social interactions, and communication signals, integrating scientific literature on rodent behavior with direct observation. This aligns with IOPC commitment to evidence-based practice and ethical treatment of animals. By considering foraging as a complex behavior influenced by resource availability and social competition, analyzing social structures for signs of stress or dominance-related issues, and interpreting vocalizations and body language for communicative intent, the consultant can develop a holistic and effective intervention plan. This approach prioritizes the animal's natural behavioral repertoire and welfare needs, adhering to the ethical guidelines that underpin professional animal behavior consulting. Incorrect approaches analysis. One incorrect approach would be to solely focus on the most obvious signs of distress, such as aggression, without investigating the underlying causes related to foraging or social structure. This fails to address the root of the problem and may lead to superficial solutions that do not improve long-term welfare. Ethically, this demonstrates a lack of thoroughness and a failure to uphold the duty of care to the animal. Another incorrect approach would be to assume that a lack of overt conflict indicates a healthy social structure. Rodents can exhibit subtle signs of stress or social suppression that are not immediately apparent. Ignoring these nuances, particularly in communication signals like scent marking or subtle postural changes, can lead to chronic stress and health issues, violating the ethical imperative to promote positive welfare. A third incorrect approach would be to implement enrichment strategies that are not tailored to the specific foraging needs or social preferences of the rodent species in question. For example, providing enrichment that is too easily accessible might reduce natural foraging drive, or enrichment that encourages solitary behavior in a social species could be detrimental. This demonstrates a failure to apply species-specific knowledge, a core ethical requirement for IOPS-certified professionals. Professional reasoning. Professionals should approach such situations by first conducting a thorough environmental and social assessment. This involves observing the animals in their naturalistic setting, documenting their interactions, and noting their communication signals. Consulting relevant scientific literature on the specific rodent species' foraging, social, and communication behaviors is paramount. Based on this comprehensive data, the consultant can then formulate hypotheses about the underlying causes of any observed behavioral issues and develop intervention strategies that are evidence-based, species-appropriate, and ethically sound, always prioritizing the animal's welfare. Question 20. Upon reviewing preliminary observations of a client's dog exhibiting concerning behaviors, an animal behavior consultant needs to select an appropriate method for systematic data collection. The consultant is considering several approaches to document the dog's behavior for a comprehensive assessment. Which of the following approaches best aligns with the principles of ethical and effective animal behavior consulting? Option A. Relying solely on informal notes and personal impressions recorded throughout the day, without a structured sampling strategy. Option B. Developing a detailed, species-specific ethogram and employing a sampling method, e.g., focal or scan sampling, that is most appropriate for the defined behaviors and the research question. Option C. Utilizing a generic ethogram designed for a different species, assuming that basic canine behaviors are universally applicable. Option D. Implementing a continuous recording method for all behaviors, regardless of their frequency or duration, to ensure no behavior is missed. Correct answer is B. Developing a detailed species-specific ethogram and employing a sampling method, e.g., focal or scan sampling, that is most appropriate for the defined behaviors and the research question. Explanation. This scenario presents a professional challenge because the choice of behavioral sampling method directly impacts the validity and reliability of the data collected, which in turn influences the accuracy of behavioral assessments and intervention plans. The International Association of Animal Behavior Consultants, IOP, certification requires adherence to best practices in data collection to ensure ethical and effective client services. Careful judgment is required to select a method that is appropriate for the specific research question, the animal's behavior, and the practical constraints of observation. The correct approach, which involves selecting an ethogram and sampling method that are appropriate for the specific research question and the observed behaviors, represents best professional practice. This aligns with IOP ethical guidelines that emphasize the importance of scientifically sound methods for data collection and interpretation. Using a well-defined ethogram ensures consistency in behavioral definitions, and choosing a suitable sampling method, e.g., focal sampling for detailed observation of one individual, scan sampling for observing multiple individuals at intervals, allows for the collection of relevant and unbiased data. This approach maximizes the chances of generating accurate insights into the animal's behavior, leading to effective and ethical recommendations for clients. An incorrect approach that involves using a pre-existing, generic ethogram without considering the specific species or context is professionally unacceptable. This fails to meet IOP standards for scientific rigor, as a generic ethogram may not accurately capture the nuances of the target animal's behavior, leading to misinterpretation and potentially ineffective or harmful interventions. Another incorrect approach, such as relying solely on anecdotal observations without systematic sampling, violates IOP principles of evidence-based practice. Anecdotal data is prone to observer bias and lacks the reliability needed for professional assessment. Finally, choosing a sampling method that is impractical for the observed behavior, e.g., using continuous recording for a highly infrequent behavior, would result in incomplete or unrepresentative data, undermining the professional's ability to provide sound advice and violating ethical obligations to clients. Professionals should approach such situations by first clearly defining the research question or the specific behaviors of interest. Then they should research or develop an ethogram that accurately and comprehensively defines these behaviors for the species and context being studied. Subsequently, they must select a sampling method that is best suited to capture the defined behaviors efficiently and without introducing significant bias, considering factors like the frequency and duration of behaviors, the number of individuals, and the observational environment. This systematic process ensures data integrity and upholds professional standards.